Hello, everyone. My name is Aisha Langford, and I'm the founder of Funeral Syllabus, where the motto is make a plan, keep the peace, leave a legacy. Today, we'll be talking about geriatric care management with Stefanie Sinks, a geriatric care manager and aging life care professional based in Ann Arbor, Michigan. Thank you for joining me today, Stefanie. Can you tell us a little bit about your journey into the geriatric care profession and what motivated you to become a geriatric care manager?
Sure, I'd be happy to. First of all, thank you for having me and for allowing me an opportunity to provide some education to your viewers about geriatric care management and the support that hopefully we are able to provide to our clients. I have always been interested in working with older adults. From the time I was a toddler being brought to the nursing home to visit my elderly great-grandmother, through the majority of my training and education, I knew that healthcare and aging was the direction I was intended to pursue. And so things just kind of fell into place. I'm originally from Massachusetts. I started off working at the Massachusetts General Hospital, working with the social work and care management departments, helping them with their resources, placements in rehabs and chronic care hospitals. And I knew that I wanted to have a greater impact, more of a clinical emphasis, being able to work with clients one-on-one. And so I actually started to work at a nursing home and a rehab center, which is what prompted my decision to move to Michigan for a graduate degree in social work. So I was able to hone my skills and focus in on the clinical aspect of working in healthcare, working with elderly. I have a specialist in aging certificate from the University of Michigan. I have a master's degree in social work from the University of Michigan. And things just kind of fell into place, knowing that I was wanting to pursue this career path. I had worked with the Alzheimer's Association, then was recruited to work at the University of Michigan School of Social Work, where unfortunately I ended up getting laid off because of budget cuts. But it opened up this amazingly huge door for geriatric care management. I had reached out to a mentor during my internship, and she said, "We don't need more therapists, we need care managers." And I said, "Great, that's what I did with the Alzheimer's Association." And I've been doing this in private practice now for 13 years, and there's no looking back. It's an amazing opportunity.
Oh, that's great. So for people who are not familiar with your type of role, what does a geriatric care manager do, and how do they support families and older adults?
Okay. So I am a geriatric care manager in private practice. So I have my own business practice. And so the luxury of being in private practice is that I can tailor the services that I provide to meet the needs of my client. My goal is always to support those individuals with independence and autonomy, whatever that might look like, and it will vary depending upon whether we're dealing with cognitive impairment. But the desire is always to help to support the client, the individual who's having the need, as well as their family and their greater network of supports to kind of navigate those resources and plan for the future, identify what are issues that are a challenge at this time, what are issues that are working, what are strengths. We want to be able to maintain those strengths. We want to address the challenges and figure out how can we optimize and make better those situations. So we're able to do everything from, in my case, assessments of capacity, levels of care. Is someone safe in their home at this time? If not, what types of resources can we bring in to support their ability to stay at home? Or do they need to look into some kind of a residential opportunity? We're able to help navigate the medical system, which is quite complicated. And one of the things that I've identified over the years of doing this is that I call them all of the ologists. As we get older, we have all of the specialists, the pulmonologist, the cardiologist, the nephrologist, the ophthalmologist. And so the desire with care management is to help our clients. I call it everybody's playing on the same sheet of music. So sometimes we're kind of like a conductor. We're not coming in and taking over, but we're just wanting to make sure everybody's playing on the same sheet of music. All of the ologists know what the other one is doing. All of the medications that are being prescribed, the follow-up appointments, the referrals. So we're able to help to streamline and coordinate that.
Okay. And what is the difference between a geriatric care manager and a social worker that may be available to patients while they're in the hospital or to patients who are being seen in a healthcare system?
Okay. That's an excellent question, and one that I get asked quite frequently. People will often say, well, I had a social worker in the hospital, or I have a social worker with my doctor's office. And the difference, the primary difference is that we are here to advocate on your behalf 24 hours a day. So I'm on call 24 hours a day, 7 days a week. When someone goes into the hospital, you have a social worker who is assigned to you, who's able to provide you with some resources, may, depending upon the hospital, help to facilitate a discharge. But once you leave, they're no longer on the case. We then step in and we're able to help to put into place all of those resources. We can go into the home and do checks. We can coordinate home care. We're able to help to facilitate the comings and goings of the providers, whether it be physical therapy. So the in-house social workers at the doctor's offices and at the hospitals are often the ones who are supplying the resources, but not necessarily following through and monitoring.
Okay. And what types of situations or challenges typically prompt someone to seek out your services?
Mm-hmm. So unfortunately, it's often an emergency situation. Someone is being reactive to a fall. Someone is recognizing, I notice a trend that after Thanksgiving, Christmas, New Year's, my referrals jump because families are coming in and saying, we haven't seen mom and dad for a while. We didn't realize how bad things were. Frequently, we'll get calls, mom or dad or whomever, they're in the hospital, whether it be a fall, a slip on the ice, a trip down the stairs, and not recognizing that. It's not uncommon for me to get calls from people saying, we knew we should have been dealing with this a few years ago. We just never did. So frequently, the kind of call that I get, the referral that I get, is more of an emergency kind of urgent need. Thankfully, I think that there's starting to become a greater push to be proactive and to be able to go out and research the types of communities that one might be interested in the event they needed residential care, explore what types of services are out there in the event that someone needed a higher level of care. More often than not, no, it's usually a reactive kind of a situation. Sometimes it's also been brought up by the elder law attorneys when people are coming in and trying to do all of their advanced planning. Sometimes it's a little bit too late because somebody has been deemed to lack capacity. So I do a lot of work with elder law attorneys in and around this area, helping people to, again, navigate the resources and working with the probate court and working with the attorneys to help to support these individuals.
And how do you assess the needs of an older adult and their family?
Mm-hmm. So oftentimes it's a lot of gathering of information. When there is a family member or I had a call this morning from an attorney who's helping a friend who's caring for a parent. The desire is to try to get as much information as possible and to kind of create a picture so I know what I'm looking at going into the initial meeting. I don't want to be jaded by any stretch, but I also want to have an idea. Are we looking at some concerns about cognition? Are we looking at some concerns about mobility? What prompted this call? So we're able to be able to get as much information as possible, and then identify the types of resources that would be available. When I go in and do an assessment, I tell people it may look as though I'm a friendly visitor. I'm going in and I'm assessing, but I'm trying to do it in a very non-threatening manner. The older adult generation is not accustomed to kind of airing their dirty laundry. And so I'm going in trying to be a friendly face, establish rapport, build some trust, so that when I do have to start asking those difficult questions, they're a little bit more inclined to share information with me. And so we're having a conversation. I'm assessing while we're discussing. I'm identifying, are they talking about things from 30, 40 years ago, but they are struggling with talking about what's happened in the last week? They don't know that I'm recognizing that that is something that is presenting or it's a cognitive impairment symptom. But it helps me to have this dialogue and to be able to engage with them while I'm assessing. I'm looking around the environment. I'm looking at the ground. Are there lots of throw rugs? I'm trying to get that bigger picture in order to be able to present to the individual and to their support network what might be the best first and next step to take to be able to support their loved one.
Okay. And for your clients, what role might you play in coordinating care between healthcare providers and other professionals?
So it really depends on what the client and their network is seeking. In some cases, people say, Stefanie, we are so overloaded. Just do whatever you need to do and just let us know. Others will say, please just help us to understand what we need to do. Help us to identify the resources and we will take care of doing the rest. So it's a very much a case-by-case basis, depending upon what the clients are seeking. I have some clients that have family members who are out of state. I have a lot of clients who have family members out of state. So much of the work that I do is, I was just on a guardianship hearing this morning. There was a family member in New England who was the power of attorney and recognized he just can't keep up with it. And so we were able to appoint me as a guardian to act on behalf of his sister, who was consenting to it. She's capable of consenting. And this way, I'm able to kind of navigate all of these different, you'll hear me talk about navigating. That's a lot of what we do. Being able to coordinate all of the healthcare and the pharmacy and the attorneys and the assisted living. So it really just depends on what the needs are and how much the family wants for me to be involved.
Okay. And how might you support families during a crisis or a sudden health change?
Sure. Again, because so much of what we do is unfortunately as a result of an incident or a crisis, the desire is first and foremost to make sure the individual is safe, and that we then take that step back, identify, okay, what are the issues and the concerns? What do we need to do in order to support that person moving forward? Is it a matter of, is the person in the hospital? Is the medical team, are they recommending that there be changes in the level of care? Can it be done in their residence, or does the individual need to move to a long-term care community? So it's a matter of taking that step back, looking at that bigger picture, what's currently going on, but also what prompted this emergency situation. Is there a situation at home where the individual is not able to manage their medication? Did we get into trouble because of medication oversight? Is the home unsafe? Are there too many stairs to navigate? What prompted the crisis? And I talk a lot about the medical situations, but there are also crises that involve, unfortunately, issues with neglect, financial exploitation. So the situation varies from client to client, but ultimately the goal is to identify what the current situation is. How do we make sure that this person is safe, and what kinds of services and supports will be needed to ensure that their needs are met at the present time and then moving forward.
Okay. And caregiving is challenging for a lot of folks, but so what are some of the most common challenges families face when caring for aging loved ones?
Not knowing where to turn and what to do. I will often tell people when someone is pregnant and expecting a child, you've got hundreds of people, dozens of people, family, friends, whatever, offering their to-do list and how to handle something and solicited or otherwise. And when it comes to caring for an older adult, thankfully there are more resources available than ever before, but it's still not something that is discussed as much as I think it could be and should be. So the desire is to be able to provide that education and to help people to understand what's out there, to be able to navigate, again, getting them connected to the various resources, whether it be home care, whether it be elder law attorneys, whether it be specialists. Oftentimes I'm working with neuropsych to do cognitive assessments so that we can have a better picture as to one's capacity and to be able to support them as their needs continue. It's often a fluid, dynamic kind of a situation. It might plateau for a period of time, but we also see that things ultimately do end up changing. Unfortunately, not always for the better. So being able to provide those resources and supports to the family members is very critical.
Okay. And what advice would you have for adult children who are beginning to plan for a parent's care?
Be proactive. Talk to your loved ones about what their wishes are. I recently just had to become a care manager for a family member. And, you and I have discussed this before where people have said, how do I do what I do? It's so stressful. And I say, this is not my loved one. This is my job. And so I'm able to take the emotional piece out of it, as a family member. Well, I just was in a family member situation. And so I see the challenges and the differences. And thankfully in this situation, there have been many conversations about wishes and desires and the what ifs and planning for the future, whether it be in terms of the legal paperwork, designating people to have the authority to act on one's behalf if they're no longer able to, but also understanding the financials, making sure that they have a list of, I was going through getting all the names of the doctors, the accountant, the attorney, the medications, trying to get access to portals. A lot of us are now on portals for our medical providers. So being able to have all of in Michigan, at the Michigan Medicine Health System, we call it the Friends and Family form that gives the doctors permission to talk to certain individuals without having to call every single time and say, is it okay if I speak with Stefanie? So there's a document that's in their medical record. So being as proactive as possible with hopes that you don't ever have to utilize all of that you've planned for, but it's so much more beneficial to have it in place, to know what those wishes are in the event that there is a crisis.
Okay. And let's talk finances and money. So how do people typically pay for geriatric care manager services? So for example, does health insurance cover it? And are geriatric care managers like yourself, is it usually always like an hourly fee or are there different models?
Sure. So fortunately, there are some long-term care insurance policies that do have a clause for geriatric care management. Some of them are connected to a clinical focus. So one who is providing geriatric care management services may need to be a clinical social worker. Unfortunately, the insurances do not provide reimbursements or coverage. Your Medicares, your Blue Crosses don't have a geriatric care management reimbursement or payment system. So geriatric care management is a private pay. Care managers generally have their own model for billing. Some of them bill hourly with requirements of a certain number of hours per week or per month. I can speak to my system, and I have no requirement in terms of how many hours you utilize my services. If it's 5 hours once a month, that's all. If it's 50 hours in 2 weeks, that's completely up to the client. I always emphasize nothing should ever come as a surprise in terms of billing, and that the client or the person designated to act on their behalf will always, in my case, know what it is that I'm doing.
Okay. And we talked a little bit about this earlier, but caring for aging loved ones is a blessing, but it can also be stressful. So how do you help families stay hopeful when caregiving can be so difficult?
Mm-hmm. So again, having just experienced it myself as a family member, I have a greater appreciation for the emotional component that comes into play. I think that taking care of oneself is enormous, and being able to take that step back and wherever possible, delegate, ask for help. I was just on the phone today with another family member saying, I need help. I need somebody else to step in and to provide some support. And recognizing this is what I do for a living, it was a greater appreciation for how stressful this can be for a family member who does not have the knowledge and the access to the resources that I have insofar as providing care management services. I think being able to take that step back, to be able to breathe. We're not going to, even though this is what I do, I cannot necessarily stop a crisis from happening. As long as an individual has capacity and can make their own decisions, I will always tell my clients, I will be here to help pick up the pieces should they fall apart. But we want to respect their independence and their autonomy to be able to make their own choices. And I think family members have to be able to understand that as well, that it may be very difficult to sit back and watch as our loved one is doing something that we know is probably not going to be in their best interest, but to be able to support them and to have those resources in hand to move forward, I think is huge. And again, self-care is enormous. Being able to take an opportunity. I'm almost embarrassed to say this to people, but I have found that there are times where picking up a good book and just checking out into a different headspace where you can focus on something else other than the current situation gives you that little trip away, just by holding a book. Something like that. Exercise is enormous, but certainly, as I've told people before, you are of no use to your loved one if you are falling apart.
Right. And that's actually a nice segue into my next question. So can you talk about the concept of anticipatory grief?
Sure.
What is it, and how do you help families deal with it?
So people often think of grief as an emotion, a feeling that we experience when someone has died. Anticipatory grief is something that we deal with as we are watching somebody fade away or not be the person that they were before. And so oftentimes we will see this with folks who are dealing with dementia. The person may look the same, but we know that their personality may have changed. Their level of care has increased. I have a lot of clients who will say, I'm not stupid. And I say, you're right, you're not stupid at all. Right now, we have some things that we can do to help to support you to stay as bright and able as you are. And it's very, very hard for their loved ones who, if it was a mother, for example, the mother raised this family. In many cases, the mother was working. The mother was the person who kind of kept the household together. And now the mother's needing help with bathing and dressing and grooming and feeding and toileting and can't manage her finances. And somebody needs to come in and check her medications. And all of these losses that these folks are experiencing contribute to this concept of anticipatory grief, the losing the loved one while they're still actually here with us.
What are some of the trends that you're seeing in elder care and geriatric care management?
Sure. So interestingly, as challenging as COVID was, I think one of the things that came out of COVID that has been enormously helpful has been the focus on technology. And the older adult population is not as well-versed as, I have got a niece and nephew who are young and probably learned how to scroll before they knew how to flip a page of a book. But the technology that's available and actually the resources that are available to our clients to support their use of technology has been enormously helpful, whether it be virtual visits, whether it be being able to interact with family members, having the video visits and people being able to check in on their loved one from across the country has been a huge change in how things had been done prior to 2020. I think we've been dealing with for a while family members. It used to be that a lot of the families would be within the same community, oftentimes multiple generations in the same home. We're not seeing that anymore. There are people who are all over the country. My own family, there are 3 adult children and we're in 3 different states. Our parent is in a 4th state. So I think that it's definitely, we're seeing a trend in folks living elsewhere and having to focus on finding those supports from afar. So one of the reasons why having a geriatric care manager can be so beneficial, people sometimes will refer to me as their surrogate daughter. So I'm certainly not coming in and saying I'm part of the family now, but I am stepping into a role that an adult child might be able to participate in if they were living locally. I think some of the other trends that I'm seeing, which again emphasize the need to be proactive, a lot of communities are really now focusing on independent living. I'm confident that has to do with cost. There's a lot more overhead when you're having to provide staffing and nurses and hands-on care. What I have been noticing over the past few years is this emphasis on independent living. So people can move in, they can have their own apartment, they have access to meals, they have access to housekeeping, laundry, life enrichment, exercise. But if they need more care, then it's on the client to pay for that, bringing in private duty care.
Okay.
So a lot of the what we call continuum of care communities that used to be the various independent living, assisted living, nursing home, memory care, rehab, those are becoming fewer and fewer. And we're seeing more independent livings, big ones, with a smaller number of assisted livings and maybe an even smaller memory care.
Oh, wow.
So it's not a trend that I'm particularly happy with, because it leaves a lot of my clients in a situation where, what do we do? How do we support them? But it is a trend that I am observing. So being proactive and being able to figure out what it is that we want in the event that we need supports, I think is again so very important.
Okay. And then related to that wonderful answer, what resources or tools would you recommend for families who are starting to think about caregiving and just like where to start?
Sure. So I think I'm a very big advocate of geriatric medicine. You know, when people have children, they take their children to a pediatrician. If there's an opportunity for your older adult person to go see what we call a geriatrician, ideally that would be my starting point. And in some cases, you don't have to establish primary care with them. You can go for an assessment where they are able to identify, are there some medical issues that need to be addressed? Many of them will have social work staff within their office. They also are able to then also refer to geriatric care managers to help to provide that continuity of care outside of the clinic. So there are so many different available resources online. If we're dealing with dementia, for example, or concerns about diminished cognition, certainly there's the Alzheimer's Association. There's, there are organizations for Parkinson's, for Lewy body dementia, so many different resources online. And then home care supports. Again, ideally, I'm not a huge advocate of going online and just picking one. If you have a contact, whether it be someone in the medical provider's office or whether it be a geriatric care manager who can help to identify what the needs are and maybe make a connection that would be most appropriate, then I would recommend that. But there is an organization, there's a care management parent organization called the Aging Life Care Association, and they have a wonderful link to find a care manager. So if you go to the aginglifecare.org, you'll see a link to find a care manager. I can't speak to my colleagues across the country, but I can tell you when I get calls, I often will tell people, you don't have to hire me if you're just looking for this. If you're looking for some geriatric practices in the area, please let me do that for you. Let me provide you with that information. And then if you need greater supports moving forward, get back in touch with me. So hopefully, I would imagine, based on my experience with other care managers throughout the country, they would be willing to do the same thing.
Okay. And so you already answered part of my next question, which is, people may be listening to this podcast from across the country and how they can find a geriatric care manager. So that organization seems very helpful. And we'll put the link in under the show notes in the YouTube and the Spotify. But just my last question is, when people are considering hiring a geriatric care manager, what types of things should people be looking for to see if that person may be a good fit for their loved one or their family situation?
Sure. So I think it's important to find that individual who's going to listen to what the needs are, to be able to help to identify. Again, I mentioned earlier, the desire is to be able to identify areas that need a boost and support, but we also want to identify those areas that are working for that individual and to be able to support and maintain those strengths. So I think, the desire would be to be able to help these individuals to figure out how to move forward, how to provide all the different supports and services in a way that is going to work for them. When I get calls, it's a matter of listening to the individuals, identifying what are the concerns. We're going to unfortunately need to have some conversations that are highly personal. I don't ever say to someone, tell me how much money you have, but I do need to have an idea as to what are the financial resources. I don't want to set you up with services that you might not be able to afford. So being able to have that level of comfort with a care manager, to be able to disclose some personal information that they may not be accustomed to sharing with someone who initially is a total stranger. I hope that clients will understand that the reason why we're asking these difficult questions is to be able to best support their loved one. So being able to come to a conversation with, this is what we're seeing, these are the concerns that we've identified, or the doctors identified, or the lawyers identified. And sometimes it's a matter of saying, I don't even know what you do, Stefanie, but I was told to call you. How can you help us? So really having an honest conversation. I will always have, I say that I'll have a 30-minute complimentary meet and greet. It usually turns into at least an hour, because I don't want people to feel rushed. I want them to have an opportunity to learn about care management, but for me to understand if this is something that I can support them through. So.
Okay. Well, that's very helpful. And I just wanted to thank you for sharing your time and expertise. Again, geriatric care management, I think, is a topic and a role that a lot of people haven't heard of. And it could be helpful, especially, as you said, people are living further apart from their family members, or even if they live close by, where a lot of people are in the sandwich generation where they're taking care of their parents and children, or trying to just manage their own lives and their jobs, and having that extra help can be very helpful depending on this circumstance. So I really appreciate your time.
No, it's my pleasure. And if I can just thank you for providing the education and getting the word out. It's so common for me to get a call or a referral and say, I don't even know what you do. I don't know what a geriatric care manager is. How can you help us? So you're providing that education and the knowledge and resources to your viewers, your listeners. And so I'm very grateful to you spreading the word.